Hello, my name is Haley Barron, and today I'm going to be talking about the components of the skeletal system. The components of the skeletal system include the bones, cartilage, ligaments, tendons, and joints. Joints are when two or more bones are joined together. Cartilage is our fibrous connective tissue that gives us a more flexible support. Our ligaments are going to attach bone to bone. Tendons are going to attach muscle to bone. With our bones, we have our appendicular skeleton and our axial skeleton. Our appendicular skeleton is going to be comprised of 126 bones, and it's going to include our upper, lower limbs, pectoral girdle, and our pelvic girdle. Then we're going to have our axial skeleton. It'll be comprised of 80 bones. So it's going to include our more medial sagittal line. It'll have more of the head, our vertebrae, and thoracic cage. So overall, we have 206 bones in the body, made of compact or spongy bone. To classify bones, we have 5 classifications. You have long bones, short bones, flat bones, irregular bones, and sesamoid bones. For our long bones, these are going to be our compact bones with spongy bone at the end portion of the bone. So for that, it'll be our arms, legs, fingers, and toes. Long bones of the arms are going to be our humerus. And then our more lateral will be our radius. More medial will be our ulna. For our leg, we will have our femur. More laterally, we're going to have our fibula. More medially, we'll have our tibia. For our fingers of our long bones, we're going to have our metacarpal 1, metacarpal 2, 3, 4, and 5. For our phalanges, metacarpal 1 will only have a proximal and a distal portion, but metacarpals 2 through 5 are going to have phalanges with a proximal, middle, and distal. So proximal all the way through, middle all the way through, distal all the way through. For our toes, our metatarsals are going to have a metatarsal 1, metatarsal 2, 3, 4, and 5. For our phalanges of our metatarsals, it'll be the same as the metacarpals. Metatarsal 1 will only have a proximal and distal phalange, whereas metatarsal 2 through 5 phalanges will have a proximal, middle, and distal. So proximal all the way through, middle all the way through, distal all the way through. And that concludes our long bones. For our short bones, this is going to be spongy with a thin layer of compact bone on top. Our short bones are going to mainly be our carpals of our wrists and our tarsals of our ankles. So for the carpals of our wrist, starting near metacarpal 1, you're going to have our trapezium. Then we'll have our trapezoid. Next to that, we'll have our capitate, and then our hamate. Next to that, we will have our tricretium, and above that is a little bone is the pisiform. Going back down, we're going to have our scaphoid, and then we'll have our lunate. For the tarsals of the ankle, just below the tibia, we're going to have our talus, and then we're going to have our our calcaneus. Talus, calcaneus. Then just below the talus, we're going to have our navicular. And on the most lateral portion, that will have our cuboid. Then we're going to have our lateral cuneiform, intermediate cuneiform, and medial cuneiform. And that will conclude our short bones. Next, we have our flat bones. These are going to be more of our thin, flattened out bones that kind of provide a attachment for muscles. So our flat bones are going to include cranial bones, our scapula, our pelvis, and our thoracic cage. For our cranial bones, our most posterior portion is going to be our occipital bone. On the side, we will have our parietal bone. In the front, we will have our frontal bone. In the anterior portion, we're going to have our nasal bone. Then we will have our lacrimal bone. which will be right here, inner portion of the tear ducts of the eye, is the lacrimal bone. Then we'll have our vomer, which is the connective tissue in between our nasal cavities. Moving on to our thoracic cage. We'll have our sternum, have a manubrium and a xiphoid process. But for your ribs, you're going to have 12 on each side. Your first 7 are your true ribs. 1, 2, 3, 4, 5, 6, 7. These are our true ribs. And then you're going to have 8, 9, and 10. These are going to be our false ribs. 11 and 12. These will be our floating ribs. Next, we'll have the pelvis. For the pelvis, we're going to have our ilium. We'll have our ischium. And we'll have our pubis. And then for your scapula, this will be on the posterior portion of the skeleton, right here, right here. So that will conclude our flat bones. Next, we will have our irregular bones. Our irregular bones are going to be kind of based on, their shape will be based on the function of the body. They will also be spongy bone with a thin layer of compact bone on top. So this is going to include our vertebrae and our facial bones. So for our vertebrae, you'll have your cervical spine. C1 is your cervical spine. So C1 is our atlas. C2 is going to be our axis. Then you have C3, C4, C5, C6, C7. After, so C1, C2, 3, 4, 5, 6, 7. I apologize, counting too far. So we'll have C1, C2, C3, 4, 5, 6, 7. And after that, we will reach our thoracic spine. We have 12 vertebrae for that. So we have T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Then after that, we will reach our lumbar spine. We have 5 lumbar vertebrae. We have L1, 2, 3, 4, and 5. Once we reach the end of that, we will reach our sacrum. And at the end of the sacrum, we have our coccyx. Next, we have our facial bones. For our facial bones, we have our temporal bone, zygomatic bone, or cheekbone, sphenoid bone, have our ethmoid bone. It's going to be back in the more posterior portion of the eye. We have our lacrimal bone. Then we're going to have our maxilla, right up here, the mustache area, mandible, the lower jaw. And then we're going to have our palatine, which you can't see. It's going to be in the inferior posterior portion, more internal on this, but we can't see it. It's going to be between the sphenoid and the maxilla. You have your hyoid bone, will be low here, is also not able to be seen on the skeleton. And next you're going to have your inferior nasal conch. It's going to be more, it's one of 3, and it's going to be more on horizontally along the lateral portion of the nasal cavity. So your palatine, your hyoid, and your inferior nasal conch are not able to be seen on this model. But that will include our irregular bones. So after your irregular bones, we have our sesamoid. The number of sesamoid bones depends on the individual. It's not the same in everyone. The only one that is the same and the most commonly found in everyone would be our patella. So these bones are going to be more small, round shaped, and our patella is the most commonly found sesamoid bone in the body. One way that knowing the clinical application of the bones will be helpful in my future career as a physical therapist, your knowledge on the body, the bones, and the structure entirely will depend on how you'll be able to give your care. So being able to know insertions, origins, ligaments, muscles that are attached to bones, what bones are, what articulates with what, it's going to help me deliver better care to my people and also to kind of solve the problem a lot faster if I did not know the structure of the body. Thank you.